Hi, it's a nursing professor. Today I want to start a section called Fundamental Fridays. And in this, I will give you one of the lectures that I taught this week in 5 minutes or less, just highlighting the particulars. This will be excellent for any student that's in fundamentals of nursing right now, or any nursing student at any level, because the truth is, when you take your NCLEX, a lot of those test questions go back to fundamentals because they think that you're more focused on the more complex issues. All right, so here we go. Today we're talking about infection control, which is of utmost importance. We know that nosocomial infections or hospital-acquired infections can be a leading cause of death in some of our patients. And so it's very important that we understand not to transfer those organisms from patient to patient. All right, so whenever we have a microorganism and that it becomes disease producing, it's called a pathogen. And so these pathogens have 6 links of infection. And number one is that you have the infectious agent. Okay, so that could live on a desk, a table. It could be you stepped in the elevator and somebody just finished coughing or sneezing and they're already sick. It looks for a reservoir, so it wants to come into our bodies and it wants to live there and multiply. So we walk into an elevator, somebody just sneezed, they were just sick. It can enter our body, and it can enter our body in various ways because we have mucous membranes that are exposed, so we will inhale whatever that pathogen is. So it stays there for a while, it multiplies, it makes you sick, and then it wants to exit. All right, so then it exits, and the way that it exits is fairly similar to the way it entered, through contact, through airborne, through droplets, all of the things that we can give it to someone else. Then number 4 would be, it looks for a contour of entry in somebody else. So it's going to look for a susceptible host. Typically that's somebody who already is immunocompromised in some sort, but sometimes it's any of us that may be exposed to any of that. It could even be a bite from a vector like a mosquito and West Nile virus. And I have a personal story I can tell you about that one. There are 4 stages of infection. They include the incubation stage, and this is when people have no symptoms, but they could be carriers. And we saw this a lot during COVID. We have the prodromal stage where people have vague symptoms like, oh, I'm a little bit tired than I normally am. Then you have the full-blown illness, and that's when you actually have the cold, the flu, the whatever is the infection. And then those microorganisms start to decline as we start to feel better, and then we go into a convalescent stage, and that is when we're actually recovering. All right, and so back to number 5, portal of entry. So it gets into another person's body, it does the same thing, and then it's just one circle of events that actually happens. All right, so then we have 2 types of infections, local and systemic. Local means just one area, like you might have a tooth infection or one of your fingers might be infected. Something like that's local. It's isolated to a particular point. But you can have systemic infections where it impacts the entire body, okay? And people typically are much sicker from those. We also have a classification of acute, chronic, and latent. Acute means sudden. Usually it's sudden, rapid onset. It can be very severe, or we can have chronic that is pretty long-term, has a slow development, more like your emphysema, your osteomyelitis, things like that. The latent stage is when a person has the disease, but they have no symptoms. And typically we see this in people who may have HIV, AIDS, or TB. All right, and so what defenses do we have to this? Because otherwise all of us would be sick all the time. All right, so primary, we have intact skin, so we want to make sure that we're washing our hands, but we're also using some sort of moisturizer so we don't have dry, cracked skin. Our mucous membranes help to protect us. Tears, you notice if you get something in your eye, then your eye will tear because it's trying to wash it out. So that's the body's natural way of trying to get rid of the exposure to some of these pathogens. And then we have our normal flora in our GI. system where it actually takes care of some of that bacteria that may be on our food that we actually eat, and so we don't get sick every time we actually eat. Urinary system also has some protection as well. We also have secondary defenses, and those are the biochemical processes that happen on a cellular level, like phagocytosis, things like that. And tertiary, we have B and T cells that actually work to keep us healthy. All right, so factors that put us at an increase of infection are the developmental stage. We know infants are more inclined to get sick than others. They don't have a real good immune system. Breaks in our skin, people who have chronic diseases, smoking, substance abuse, multiple sex partners. Okay, meds that increase or decrease our immune response, like steroids, prednisone, any of those things that you might have to take, chemotherapy drugs, and nursing and medical procedures. So anytime that you actually do a procedure on a person, you're putting them at a greater risk for infection because of exposure. All right, so factors that support our immune system, and this is what things that we want to do, is adequate nutrition, balanced hygiene, exercise, rest, reducing stress, and immunizations. I'm not going to say anything about that. All right. Two more things that you need to know. You need to know the difference between medical asepsis, which is when we're talking a clean surface, hand washing, putting on gloves, those types of things, versus a surgical asepsis where you do a 2 to 6 minute scrub where you have a sterile environment and you're making sure that you're not touching surfaces. Hands are always above the waist when you're in a sterile environment. Then last but not least, we have protective isolation. Sometimes it's called neutropenic precautions. And this is when we're protecting our patients from ourselves. And so we're making sure that we have on personal protection equipment, that we're not taking care of other people who may have infections that we could easily transfer over to this patient. So if you get an assignment where you have somebody that has TB and you have somebody who has neutropenic precautions, you're like, charge nurse, no, this TB person got to go. All right, so I hope that helps. I know that was a mouthful. I'll see you next Friday with another topic. Bye for now.